Difference between lupus nephritis and membranous nephropathy. Look at this picture, shows that MRI biomarkers of lupus nephritis, then membranous nephropathy MRI findings, a detail going on. What is lupus nephritis? It is an inflammation of the kidney caused by systemic lupus erythematosus, resulting in symptoms like hematuria, proteinuria, and hypertension. Nephropathy. Membranous nephropathy is a kidney disorder characterized by thickness of the glomerular basement membrane due to immunocomplex deposition, leading to heavy proteinuria and potential nephrotic syndrome. Difference between one definition: lupus nephritis, inflammation of the kidneys caused by systemic lupus erythematosus, an autoimmune disease. Membranous nephropathy, a kidney disorder characterized by thickening of the glomerular basement membrane, often due to immunocomplex deposition. Two causes: lupus nephrosis, caused by the autoimmune disease SLE, where the body's immune system attacks its own tissues. Membranous nephropathy, often idiopathic but can be secondary to infections, malignancies, or certain medications. 3. Pathophysiology. Lupus nephritis, immunocomplexes deposit in the glomeruli, causing inflammation and damage. Membranous nephropathy, immunocomplex form in the subepithelial space of the glomerular capillaries, leading to basement membrane thickening. 4. Symptoms: lupus nephritis, hematuria, proteinuria, hypertension, swelling, and systemic lupus symptoms such as joint pain and skin rashes. Membranous nephropathy, heavy proteinuria, swelling, and sometimes nephrotic syndrome with little or no hematuria. 5. Associated with other conditions: lupus nephritis, directly associated with systemic lupus erythematosus. Membranous nephropathy may be associated with hepatitis B, hepatitis C, syphilis, cancer, and certain drugs. 6. Diagnostic test: lupus nephritis, diagnosed through kidney biopsy, blood test for anti-dsDNA, antibodies, ANA, and complement levels. Membranous nephropathy, diagnosed through kidney biopsy, swelling thickened, glomerular basement membrane and immunodeposits. 7. Immunofluorescence findings. Lupus nephritis full house immunofluorescence patterns with IgG, IgA, IgM, C3 and C1q deposits. Membranous nephropathy, glomerular deposits of IgG and C3 along the glomerular basement membrane. Prognosis. Lupus nephritis variable can lead to chronic kidney disease or end-stage renal disease if untreated. Membranous nephropathy generally has better prognosis with some cases resolving spontaneously but can also progress to chronic kidney disease. 9. Treatment. Lupus nephritis immunosuppressive therapy including corticosteroids, cyclophosphamide, mycophenolate mofetil and hydroxychloroquine. Membranous nephropathy mainly corticosteroids, immunosuppressants and supportive treatments such as blood pressure control and diuretics. 10. Age of onset. Lupus nephritis typically affects young adults, especially women of childbearing age. Membranous nephropathy most common in middle age and older adults. 11. Gender prevalence. Lupus nephritis more common in women, but membranous nephropathy affects both genders, both slightly more common in men. 12. Systemic symptoms. Lupus nephritis often accompanied by systemic lupus symptoms such as fatigue, fever, joint pain and skin rashes. Membranous nephropathy primarily present with kidney related symptoms with less frequent systemic involvement. 13. Renal function impact. Lupus nephritis can rapidly lead to decreased renal function and kidney failure if severe and untreated. Membranous nephropathy renal function can remain stable for years despite heavy proteinuria, but long-term risk of kidney damage exists. 14. Autoantibodies. Lupus nephritis high levels of anti-dsDNA and other lupus specific antibodies. Membranous nephropathy presence of anti-phospholipids A2 receptor PLA2R antibodies in many cases. 15. Response to treatment. Lupus nephritis variable response. Some patients achieve remission with aggressive immunosuppression. Membranous nephropathy variable. Some cases remit spontaneously or respond to immunosuppressive therapy, while others progresses despite treatment. Thank you. Have a nice day.